The Democratic Republic of Congo battles another Ebola outbreak as Uganda remains on high alert. Memories of West Africa's deadliest epidemic are resurfacing. In 2015, Kenya deployed 170 volunteer health workers to Liberia and Sierra Leone to help contain a virus that had overwhelmed the country's fragile health systems and claimed thousands of lives. One of them was pediatric nurse Zedi Chepchirchir Komen, who says answering that call changed her life forever. Eunice Omolo reports.
When Ebola devastated West Africa in 2014 and 2015, fear spread almost as fast as the virus itself. As the death toll climbed, Kenya answered the African Union's call for help, deploying 170 volunteer doctors, nurses and public health officers to Liberia and Sierra Leone. For nurse Zedi Chepchirchir Komen, volunteering felt less like a decision and more like a calling. But as the news of a deployment spread, so did fear.
I was thinking, what if something happens and we don't come back? We'll take care of my kids. We'll be there for my family.
Inside Ebola treatment units, however, every shift was a battle against heat, exhaustion, and the constant risk of infection.
The other similarity is about the pressure the frontliners are going through. So back in West Africa, it was really, once it was known, there was a lot of pressure because so many healthcare workers died, so many people died, and so there was panic. People were running away from work. Patients were left unattended.
A decade later, as Ebola once again threatens communities in Central Africa, Komen sees familiar warning signs.
I think in DRC, people were not prepared. The healthcare workers were not prepared. That's why we're seeing the number of healthcare workers who have succumbed and who are infected. And it was the same case which was there in 2014, 2015, where people did not know what it was and did not take care of themselves. Like IPC was something which, if we would have done that or they would have done that.
For those who answered Africa's call in 2015, the mission may have ended years ago, but the lessons and the memories continue to shape how the continent responds to Ebola today. Eunice Omolo.